Assalamu alaikum, everyone. Can you guys hear me okay? Okay, perfect. So I'm so happy to welcome Sister Nadira Qureshi here. We are also streaming on YouTube live at this moment, so please check us out. A couple of things though. If you're on YouTube, we're not going to do a good job of monitoring the comments, so best for you to log in and join on Zoom, and that way you can actually interact with Sister Nadia. So Sister Nadia, welcome. She's a licensed clinical social worker. She's got over 20 years of experience kind of counseling adults, children, and families. And she's currently has a private practice in Montville Township. I'll turn it over to Sister Nadia. Thank you so much for driving here and coming to our small masjid and giving us some of your time.
Oh,
Thank
it's
you.
my pleasure. Thank you. It's lovely to be here and see this. Everybody hear me fine? Zoom? Okay. All right. So, based on the topic that Sima gave me, I'm going to put it under the general umbrella of understanding mental health. And I'm going to talk about the nitty gritty, the practical of what goes into the process of seeking therapy. So we're going to name a client X. I don't want to use any names per se. So let's say client X has been experiencing um, feelings of sadness, difficulty falling asleep, difficulty with motivation, unable to complete tasks, worrying all the time. And it's come to the point where, let's say they even went to an imam, and imam said, pray more, make zikr. And this person is doing all of that, but they're noticing that the symptoms are not going away. So at this point, um, and hopefully, inshallah, we're having this talk with our imams to have a list of mental health resources, and for even the imam to say, hey, listen, I think you should seek professional help. And here are a list of therapists, right? Muslim therapists and things of that sort to help you out. So the first factor in in terms of looking for a therapist, I find that is the most overwhelming process for a lot of people is finding a therapist. So the first thing you have to do is inform yourself. So the way to inform yourself is to look at your insurance, number one. There's two types of insurance, in-network and out-of-network. So when you're calling up a therapist, you need to ask them, I have Aetna. Am I going to be, do you accept Aetna? Are you in network with Aetna? If you're in network with Aetna, that means that you're responsible for a copay, but a majority of the session will be covered by your insurance. The other kind of insurance that is had is called out-of-network insurance. Now, I have noticed that a majority of Muslim therapists are out of network. Out of network means they're not contracted with that insurance company. So usually you would have to pay upfront for that therapy. And then depending on your out of network benefits, you would get reimbursed. So what to look for when you're inquiring about out of network benefits? If you have them, some insurance companies don't even offer them. So number one is finding out what are the out of network, do I have out of network benefits? Question number one. Question number two is, what is my out of network deductible? Deductible is the amount of money that you have to spend out of pocket until insurance kicks in. Now, once deductible is met, you have to ask, what is my reimbursement rate? So reimbursement means that amount, how much of it will I get back? It's usually 60-40, 70-30, 80-20, meaning you would get 80%, 70%, or 60% of it back. So that's in a nutshell out of network benefit. There's another type of service that a lot of people don't know about, It's called an EAP, an Employee Assistance Program. This is something that's offered through your work. So some businesses, what they do is they contract with an agency that will provide X amount of sessions. Usually it averages 12 sessions. So 12 sessions, your company will actually pay for them. The trick is you have to use the EAP provider directory. So if you choose to do that, you would call your HR department and you would ask, who do you need to speak to for the EAP provider list? How do you get enrolled in that? Now, there's a big thing about Medicaid versus Medicare. A big misconception I've seen, and when a lot of calls I've gotten, is they think Medicare and family care is the same thing, but it's actually not. So Medicare is something that is given to somebody who's 65 and above, or somebody who is on disability. So somebody on disability, somebody who's 65 plus has Medicare. A typical Medicare insurance card is the red, white, and blue. Family care is an insurance that's given if a family doesn't meet a certain income guideline, they're below an income guideline, and therefore they are eligible for assistance from the government. So family care is actually the same thing as Medicaid. They're the exact same thing. So that's for low-income families. So that's the difference between Medicaid and Medicare. The thing in New Jersey is that anybody that's in private practice usually does not accept Medicaid. So if somebody has Medicaid or family care, they would usually have to go to a mental health center in order to seek those services because it's not provided in private practice. In New Jersey, that's just a rule. They're looking to overturn it. So that's in a nutshell what insurance would look like and what you would need to know, gather information before you reach out to a therapist. I'm going to pause there because that was a lot of information and see if anybody has any questions. Yeah. Yes. So single case agreement is something where the therapist or the client gets in touch with the insurance company and says, hey, listen, Aetna, I'm out of network with you, but I want to have a single case agreement with this client that I'm about to see, or the client says single case agreement. So it is a little bit of a process. You do have to fill out paperwork. I know that when I had done a single case agreement, it took them a couple of months, believe it or not, before it got approved. The client did it on their end. But so basically, and then I did have to provide information like, what my diagnosis would be, the frequency, and, my licensing number, NPI number, and all of that stuff. And then they look at it, and then it's up to insurance whether or not they approve it. The thing with single case agreement is that usually therapists that are out-of-network providers do them few and far between because it is a little cumbersome, right? Now, if the client is willing to do it on their end, doing all the work and legwork, and they're willing to wait that month or 2 months to get insured, it would work. And then the single case agreement becomes, will the insurance reimburse the client directly, or will it go to the therapist? So then they decide what to do with that. I do know that sometimes they say that single case agreement gives more of a reimbursement versus you've met your out-of-network deductible and then you're being reimbursed. So, and it depends on out-of-network deductible. In terms of out-of-network deductible, I've seen as low as 250. Actually, recently I saw 0, which was a first. I've never seen that. But usually 250 is the lowest and the highest is like 15,000. So there's a huge range of what out-of-network deductible would look like. But yes, single case agreement is something that I think is underutilized. Anybody else? Any questions? Okay. So now the next step, now that you have all of this information on what insurance looks like for you and what questions to ask, you got to find a therapist, right? You got to find a provider. So if you decide you definitely want to do in-network, one is going directly to your insurance provider directory, typing in therapist, mental health therapist. That should usually yield some form of a search. I've noticed sometimes they don't update all of their information, so it's really important, whoever you call out to, make a short list of, let's say, 5 therapists. Whoever you call out to, number one, find out, are they accepting new clients? Number two, are they in network? Because they may have decided to drop it, but it hasn't been updated. So that's important to find out. So insurance provider directory in that sense works. I have noticed that Medicaid actually has a provider directory too, but it's pretty inaccurate. The second one, which a lot of people reach out to me through, is Psychology Today. So psychologytoday.com, you put in, the state or whatnot, you can actually even filter it and say you want a Muslim therapist, you filter it faith, Islam, and it'll yield what that would look like. So it's got a pretty good filtration system. The one caveat with Psychology Today I noticed is that a lot of therapists say they accept certain insurances, but they're actually out of network with them. So again, it's finding out, are you in network with this insurance company? That's important. Primary care physicians are always a good source. Let's say you're going for your physical. And so one thing that a lot of doctors have started doing in their physicals is giving a depression and anxiety questionnaire. And so after you take this questionnaire, it yields a certain result. The depression questionnaire has questions like, how often do you have difficulty falling asleep or staying asleep? Or, how often do you have a change in appetite? Or how does this affect your functioning? It's a series of 9 questions. If you yield a certain number, the doctor kind of flags it and says, all right, you're scoring high on the depression questionnaire. Let's talk. Same thing with anxiety. There's an anxiety scale. And when you administer it, you can tell, okay, this person is high on anxiety. So then you can have that talk and say, okay, doc, so I need therapy. Anybody you recommend? So they would recommend somebody. They usually have a short list. Another option is a Google search, right? Like a lot of people have just found me by Muslim therapist in North Jersey. And then my name kind of pops up, which has a link to my Psychology Today profile. Assalamu alaikum, ladies. So, Google search, there's two services you could say out there that is a pretty good alternative to, you want somebody in private practice, but you're not finding anybody in network. One is called Alma, ALMA, and one is called Headway. These are 2 agencies where pretty much they contract with private practice providers. So they're paying probably more than what insurance would pay, but then they do the legwork. So you would go to headway.com and you would do a search. So essentially you're contracting with Headway. So you would fill out Headway's paperwork or Alma's paperwork. And then they would basically, you would get those same services you would get with an out-of-network provider, but it's being covered. Again, I think something that's underutilized. So Alma and Headway, I think, are two good resources as well to make that work. Okay, credentials to look for. So there's so many letters, right, after every provider that you see when you're doing these searches. So I'm just going to go through a few of them. LPC is a licensed professional counselor. So an LPC is somebody who's had probably about 2 years of postgraduate, 1 or 2 years, something to that effect. They're outpatient, pretty much the same. I'm an LCSW, so, pretty much around the same lines. In terms of insurance, they'll probably get reimbursed a little bit less. There's an LSW, which is a license in social work. So these people are ones that have graduated from the School of Social Work. They've gotten their master's, but they're just starting out. So they're just starting out. So they're in the beginning phases of work. They're under supervision. LSWs cannot have a private practice. So they're usually under the supervision of an LCSW. LCSW is somebody like myself who, under being an LSW, you do X amount of hours, which usually spans about 2 years worth of hours. In psychotherapy, X amount of supervision hours, and things of that sort, and then you have to take a licensing exam. You have to take a licensing exam for an L as well, and then LCSW, you have to take your second licensing exam. After that, you become a licensed clinical social worker, LCSW. These are ones that are in private practice usually. They usually have more experience, things of that sort. Now you have a PsyD or a PhD. These are people who have had their doctorate. They have done their bachelor's in psychology, master's in psychology, or like PsyD is a master's PhD program combined. They do their thesis and things of that sort. So they also are in private practice. LCADC. LCADC is a licensed certified alcohol and drug counselor. These are the letters you would look for if you're looking for substance abuse treatment. You could have an LCA, usually it's LCADC and an LPC, or an LCADC and an LCSW. You would kind of see those together. So that's somebody you would need if somebody is having substance problems, which, let's be real, in the Muslim community, it exists, right? So that's something to look for, is LCADC. LMFT is licensed in marriage and family therapy. So this is for somebody who's seeking marriage counseling or family counseling. Again, this goes also in line with an LCSW or PsyD, LPC. They all may have it. So let's say you're doing a search and you decide, you know what, I need marriage counseling. LMFT is a really good certification to look for. So you could just type in LMFT, and then it'll give you a very specific search for what type of provider you're looking for. Now, the new thing that's come up is a coach. What is a coach, right? How is a coach different from any of these? A coach doesn't have that proper certification or that schooling that any of these providers would have. I believe they do have to take a certain course and things of that sort, but insurance will never reimburse somebody who is a coach. So that's not a qualified provider under insurance. I have noticed, though, because I am an EAP provider, that the EAP provider that I work for actually does a lot, like 12 sessions for coach and 12 sessions for therapy. Now, all of these providers that I have listed, none of them can prescribe medication. So if you want medication, you need to go to an MD or LPN, like a licensed nurse, or your PCP, right? Your primary care physician. So that's who you would have to go to if you want medication. And again, that is a talk you could have starting with your primary care physician and saying, primary care physician may say, here's the therapy and here's the psychiatrist, decide which one you want. And so that's a different territory, because a lot of people are under the assumption that LCSWs can also prescribe, but that's not true. All right, I'm going to pause here because that was a lot of letters and a lot of information. Anybody have any questions? Oh, so coach is basically somebody that is providing some kind of services, right? Like a life coach, counseling services, if you will, but they don't have the same training, organized training, I should say, right? Like they don't have a master's degree, like there is no master's in coaching or bachelor's in coaching. It is just taking certain courses in order to become a certified coach. And with that, coaching doesn't have as many restrictions. Like for LCSW, you can only see somebody within New Jersey, right? But with coach, I don't think they have those restrictions. And then obviously the fee for a coach would be less versus one of these licensed clinicians.
Sister Nadia, would you say that cost is one of the reasons why you would go for someone that's not an LCSW?
Yeah, I think, I think cost would be one. I have talked to a few coaches who have said to me that I can only help up to a certain extent, but I'm seeing this person has severe depression or severe anxiety. I will refer them to a licensed clinician, like this is too much for me to handle. You need somebody who's more trained. So I have heard that they kind of know what to do, but after a certain time they're like, okay, this is beyond my capacity and beyond my training, because they don't get that official training in things like cognitive behavioral therapy or this basically like diabolical DBT or whatever it may be. Like they don't have that proper training for the formal interventions, if you will. Any other questions? Okay. So now, you found the therapist that you want, right? So you found the therapist that you want and you've scheduled intake. What does intake look like? Intake will look like try to get there 5 to 10 minutes before the start of your appointment. You'll probably get paperwork to fill out. Make sure you have your insurance card with you. So you'll fill out those intake forms. Usually it's a general information confidentiality form. Confidentiality form is important. It basically states that anything that's said between you stays between you. But let's say that, for example, you need to coordinate treatment with the psychiatrist. So you're signing off and saying, okay, you can get in touch with my psychiatrist, and I'm signing off on that. Some people have a very blanket consent form. So if it's a blanket consent form, your therapist should reach out to you and say, hey, I do want to talk to your psychiatrist. Is it okay? Just to specify who it is that they're going to be speaking to. Also, there's a, HIPAA confidentiality form. You should have to sign off that you read it. HIPAA basically means all of your identifying information is going to remain private, confidential. Suicide assessment is something that's usually done during that first session, or it should be done. Be very honest, right? Like, don't be afraid that I'm going to answer these questions and he's going to ship me off to the hospital. It doesn't work that way. So it usually very basic questions. Any thoughts of hurting yourself, or have you tried to do anything to hurt yourself? And if any of that is a yes, then you go into more specific details of when that was and what it was. Some therapists will give out that depression and anxiety scale just to get an idea what the depression and anxiety scores are looking like. They will review the confidentiality. My go-to always is everything stays between you and me unless you're in danger of hurting yourself or hurting others. If it's a child, I'll say, or if somebody's hurting you. But if it's something that I think mom or dad needs to know, I'll talk to you about it, and we'll work together to tell mom or dad about it. So this way I gain their confidence a little bit. History, I try to get like a family history, a social history. Don't always do medical history, but sometimes medical history is very important. So depending on how they're presenting, we may go more into medical history, what medications they're currently taking, different issues. My go-to line is always, tell me the series of events that led you to seek therapy. What happened up until the point where you decided, I need to look for a therapist? And so then that usually covers what current issues are looking like. And then hitting a little bit on goals. How will you know that you're feeling better? What will be different? So that gives an idea of what the desired effect is of therapy. What are you looking for? So that's basically how it works. After that, some therapists mandate weekly. It depends on, who it is. Some people say, I can only do twice a month. I can't afford weekly. So it's up to the therapist to say, okay, yes or no. Basically that's the gist of it. And then you go in. Sessions usually should be about an hour, give or take. Some therapists do. So the coding system, how it works is there's a 30-minute, a 45-minute, and a 53+ minute. So half hour usually doesn't happen. So you can have a therapist either do a 45-minute session or 53+. So that's how the coding works for that. But usually it's about an hour, is what I've been seeing lately. And then it's just really important to trust your therapist, right? And to be able to talk about everything, to not hide anything. I think it's really important. There was this one, I have to, such a good example. And I was in the beginning of my career, and there was this child that came in. He was maybe 7 or 8, and he was refusing to go to school, latching onto mother, lots of anxiety. And the parents were like, I don't know what's going on. I don't know why, this, that, or the other. He's just really anxious. And I guess my intake department had asked for some forms because at some point, DIFUS or DCPNP had gotten involved. So now I get this huge packet from DIFUS, and this was a Pakistani family, right? And so you would think, basically what happened was the father and the mother separated, and the father kidnapped this child and brought him to the US. And there was literally posters out on the streets of their city in Pakistan for a missing child or missing children. And I was like, of course this kid's going to have anxiety and, like separation issues and this, that, or the other. So when I confronted them about it, they stopped coming, because they were, I don't know, ashamed of it, right? Of what had happened. But for me as a clinician, it's so important to know the backstory, because it directly affects the issues at hand. So it's really important to give the right history. And I know the Muslim culture, there's this whole thing about protecting your family's reputation and just not saying certain things and whatnot. But it is a very safe, confidential space. So you should be able to talk about whatever it is that is happening in your family, happened in your life, whatever it may be. There's no shame in it. But I know we have a long way to go as a community on that.
So I have a question.
Yeah.
First question, I actually have two. One is, who can provide you a clinical diagnosis? Is it just a psychiatrist or any of you?
That's a good question. So basically, after a clinician like myself does the intake, I generate a diagnosis based on everything I see. So I would generate a diagnosis, and that diagnosis would be given to insurance, right? If we're going through insurance. Now, let's say they see a psychiatrist either before me or after me, the psychiatrist's diagnosis trumps the clinician's diagnosis, because the psychiatrist is the one who is providing the medication, who's prescribing the medication. So the psychiatrist's diagnosis always trumps the clinician's diagnosis.
Anyone have any questions?
So a lot of therapy is done on like an individual level between you and the patient. Can it ever occur as like a team for the patient, right? Because you're mentioning some things that you want the patient to give the entire history, but there could be some things in which the patient doesn't necessarily share.
Mm-hmm.
That could even be things that they're unaware of, like language or behavioral changes. So can it ever occur with like a team behind the patient?
Define a team, like a professional team or a personal team for the client?
So the professional team isn't necessarily spending every day with the patient.
Right.
So I'm saying like other people, I guess, like that may trust the patient, or it would be close to the patient that's spending a lot of time with them. So parents, friends, whoever it may be.
Yeah. And so, you know, it's very tricky because you have these 18-year-old kids, right, that are walking in, yet they are considered legal adults. And so you need their permission to talk to their parents. But I noticed that when you have the 18, 19, 20, even 21-year-old, the parents are usually accompanying them. At that point, I would have to ask, do you want your parents to come into the room with you? Are you comfortable with that? Are you comfortable with them giving a history and things of that sort? Some parents do reach out to me, of adults, to say, hey, can I have a phone call with you? You know, when the client isn't around. And so even that, I would have to reach out to the client and say, hey, your parent wants to have this talk with me. Is that okay with you? And then they would say yes or no. And based on that, I would be able to, of course, you gain valuable information, right? Talking to family members and things of that sort. But usually I've seen it more with parents and this 18, 19, 20, 21 age group. You know. Same thing with spouse, right? So it depends on whether or not they are giving permission to speak to the spouse.
So you would never reach out to them like on your own accord to be like,
No.
try to get a little extra information if something seems off or doesn't feel
Yeah,
right?
no, because I know, like, they would have to reach out to me.
Okay.
Yeah. With children, it's different, right? With children, I usually do have 30 minutes individual and then 20 minutes family. Or I'll reach out sometime and be like, hey, let's talk, right? Because I found something that was concerning or something that confused me. With children, I will.
So I had another.
Mm-hmm. 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 So that's how I found out about it, because someone else had reported it beforehand. I believe it might have been the school that had reported it when they found out about it. But yes, in a case like that, and that's why I always give the disclaimer, everything you say is between us, unless you're in danger of hurting yourself or hurting others or somebody else is hurting you. So that's kind of the DCPNP disclaimer. So yes, that is something that legally we are obligated to do. In my over 20 years of working, I have called DCPNP twice. And both times it was after intake, and I had a great rapport with the family. But one time the client reported that my mother hit me in the face with a tennis racket. The other time, the child reported that my father punched me in the face. And so the first thing I do in a case like that is call my supervisor, right? Now, I don't have a supervisor. If I'm in private practice, I will call up a colleague and say, hey, listen, this just happened. What do I do? At that time, I was working for an agency. So when you're working for an agency, you go to the supervisor and you do what the supervisor says. And my supervisor said, you got to call. You got to call. You got to call it in. And then I have to be mentally prepared that I'm going to get cursed out by this family, right? Who's going to deny it. But it was my legal obligation to do that. Mm-hmm. Mm-hmm. The line. Yeah. Well, usually, the golden rule usually is hitting with an object deems physical abuse, right? But in this case, punching in the face is pretty aggressive, right? So then that's considered physical abuse. Somebody who slaps on the butt or slaps on the face, that, yes, it's culturally acceptable. Although I think the tolerance level for that is going down as well. And then I think it also needs to play into how is this behavior that the parent is, or discipline, I should say, this discipline that the parent is giving, how is it affecting the client? Is it, affecting them negatively? Is it leaving marks? Is it leaving bruises? Is it instilling fear that is not healthy? So it's kind of the whole picture in that sense. But at the end of the day, it's up to the DCNP and DIFUS worker to determine whether or not this is a family that needs to be monitored. So sometimes it's going to be an open close case. Sometimes they say, all right, I need to see you. I need to do family visits with you for a month or 6 months or whatever may be, and reassess at that time. I don't hear too much about removal from the home nowadays. So they've become very conservative about that. Reunification is a big dialogue nowadays. So they really try to keep the family together.
Good questions. Any other question on the Zoom?
Mm. Yeah, good question. Lamia, that's you, right? So, I think what it is that we have to normalize therapy. I think it has to start from there, right? We have to normalize therapy, and everybody goes through struggles. And yes, there is this mentality of look at those who are worse off than you. So why should you be depressed? Why should you have it all, right? Look at everything that's going on out there. But what that does is it invalidates that person, and it makes them actually feel more depressed. Because I've had so many clients saying, I'm depressed. I have no idea why. I have everything. I'm not missing anything, but I just can't, I can't get over it. I can't get over it. And so then it is having those talks, right? And then there is a very real thing of a chemical imbalance that causes depression specifically, right? So then that talk needs to happen. Maybe medication is necessary. Maybe it is a good idea to do a psychiatric consult. But the biggest thing is normalizing. I'm noticing in the teenage community, it's become so normal to seek therapy, right? And all these kids are experiencing some form of anxiety or the other, but they're not ashamed of it. They're helping each other out. And so it is the kids that are telling the parents, I need to see a therapist, right? And so the dialogue is changing. And I think the dialogue, even with the imams, is changing. Um, and so I think that's what it is. And of course, I always promote positive thinking and focusing on what you can be grateful for. But at the same time, that doesn't mean get over it, right? It's working through it and feeling like, yeah, my struggle is real too. Mm. Mhm. 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 Right. And so, that's where I had talked about um, ensuring or just reassuring yourself that therapy is a safe space, right? You can talk about these toxic relatives. They don't have to be named, right? They don't have to be named. Um, you can talk about it and work through it. And sometimes just talking about it and having a sounding board like a therapist to kind of shoot it back at you, um, it it helps. And yes, Sabr is a part of it. Um, they'll go all of it as a part of it, but it's a process. It's not, it's a package, right? That you have these healthy coping skills, right? Versus unhealthy coping skills. And so faith and utilizing faith and doing dhikr, they're all coping skills that you could use, but they're not necessarily the only coping skill you can use. So it's developing this toolkit in order to process whatever is happening in your life, whatever issues are happening in your life. And, there is something to be said about, um, I had a mother and daughter, and they were like, yeah, everything's fine, everything's fine, everything's fine. And then all of a sudden, they started talking, and everybody's in tears. And it was such a good session because now the walls are breaking down. Now you're really communicating and figuring out what you need from the other person. So, this needs assessment, it's so necessary at all times. Um, and it's just you need more than that. And that's a crucial part of it. I feel sorry for clients who don't have a faith to rely on because it does give purpose, but at the same time, um, it's more than that.
Anyone else on Zoom? I actually had a question that I think really complements the last one because in my mind, I struggle with that notion in our faith of backbiting
Mm-hmm.
and talking
Yeah.
about others, and then facing your trauma
Mhm.
and sitting there and talking to someone about what you might have gone through
Yeah.
entails talking about someone else probably in a
Yeah.
very negative light.
Yeah.
Could be. So how do you? I mean, just your thoughts on that.
Yeah. I mean, I think it starts from Nia, right? What's your intention? Um, you know, backbiting, the intention is just talking about somebody badly for the sake of talking about somebody badly, right? But if you're trying to process a trauma, you need to speak about this, right? You need to be able to say, this is what happened in order to process that trauma. So it's actually something that's for your betterment, for your mental health that needs to be done. Um, you know, there's so much that gets unveiled and there's so much that gets swept under the rug, right? I'm talking specifically about sexual abuse. It's never talked about yet. You know, I'm mind blown by how much it happens, and how much it's reported to me and how the individual deals with it because nobody talks about it, right? Nobody talks about it, but it's so important to talk about it in order to process it, you know. And that does need to be with a professional. You know, your family, they can't help you when it comes to something that deep.
So inshallah, in a few years, I plan on becoming a teacher. And I just wanted to know what you think we should be doing in schools to help support children's like mental health, especially. I mean, I'm a student right now too, so it's I see like anxiety is rampant. Kids are juggling like jobs and like, athletics, and there's so much they're juggling. And I just want to know what I can do to help them.
Yeah, that's a great question. I know one thing that elementary schools specifically are starting to do, at least my kids, um, is mindfulness and practicing mindfulness. And they actually do it for 10 minutes twice a day, where it's a guided meditation with like the music and things of that sort. So I think mindfulness is a good one, just for any age group to kind of say, all right, guys, let's turn off the lights, you know, put on some meditation music and let's meditate, right? Let's take some deep breaths. And I've noticed with the high school, actually, middle school and high school, diaphragmatic breathing is a really good technique to know. The little ones call it tummy breaths, right? So it's very effective, especially when it comes to anxiety. And all these kids are talking about having panic attacks, right? And when that happens, you know, it's it may not necessarily be a panic attack, but because they think of it as a panic attack, we got to validate that, right? And so it is a panic attack. And so I think mindfulness is a part of it. Encouraging journal writing, I think that's a good one. And just, again, creating a trusting, safe space. Like if anything is happening, for them to even go to you, right? Because let's face it, teachers are the ones that spend time with the kids, even more than parents. So, you know, it's a really crucial role being a teacher. Mhm. Yeah. And so, you know, first you talk about it. And then after you talk about it, you decide, right? If this is something that's completely out of your realm, you say, is it okay if we talk to the guidance counselor about it? High schools have SAC counselors, SAC. Some high schools do. I don't know if all do. But there's psychologists on staff usually. Yeah, first step is usually guidance counselor, but you have to make sure that the child is on board too, right? If the child is saying like, no, I don't want you to talk to anybody about it, you know, I want you to help me, then open up a dialogue. How do you think I could help you? First of all, praise them, right, for trusting you and opening up. And I'm so happy and I'm so glad you were able to come to me with this. And I'm sorry that you're struggling with it. Validate, 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 right? After that, you can talk and say, so I think this is something that you do need to talk to the guidance counselor about. Is it okay if we go together and walk them there and see what happens? You know, if it's something that's really intense, again, I think it should be, and they're saying that, no, don't talk to the guidance counselor, but you feel that I think the parents need to know about this, then you may have to say, this is something that is concerning me, and I really think we need to do this.
I have a question. As you were mentioning earlier regarding that the patients that come to you, you have the privacy, you don't share, you know, even they're teens or 18, 20, maybe a spouse, whoever comes to you. So as a family member or as a parent or as a spouse, as a community, if they don't allow you to share your, you know, thing that you're going through depression or anything bad has happened to you, so it's your job to keep that as a privacy. But as a parent or as a spouse or community member, as a friend even though, I would say, how can we get to know, okay, this person is having a trouble or needs help,
Right.
or is in depression,
Yeah.
or rather than making fun of that person, okay, he's not talking to anybody, or he's not behaving well, or sometimes, you know, the people who are depressed, they don't show it to other person.
Yeah.
They said like, everything is fine, don't bother us, or anything, you know, they just show you that they're fine. But how can we reach out or get to know, okay, this person need help?
Right. So I think, again, it depends on the age, right? If it's somebody who's less than 18, I would, right, I would have a conversation with the parent and saying, okay, so these are some struggles that I'm seeing that have been discussed. There are certain things that the teenagers will say, please don't tell my mom, right? And so I won't, but, you know, sometimes you just do. And if it's somebody who's 18 and over, you have to, I think that parent needs to be a little proactive and reach out to the therapist. Just, you know, shoot them a text or call them and say, hey, I kind of wanted to talk about what's happening. And then the therapist may say, well, I need permission of your kid, right, in order to do that. So then once that permission is obtained, there's a dialogue that can happen, you know. But there's nothing wrong in reaching out. I have parents reach out all the time and be like, can I talk, da da da, you know, whatever it may be. And that's okay. It's okay to have that. And a good therapist will take the time and talk. In terms of spouse, I usually encourage the clients to start this dialogue with their spouses. Some of them say, I'm going to bring them into session. And I'll say, okay, that's fine. And so we will have a couple session, you know, to improve communication, whatever it may be, in the midst of it. It doesn't mean that every session is going to be that way, but just to get an idea of what the other party is thinking. Answers the question. Okay.
Any questions on Zoom?
Well, it depends on what it is that you know, right? again, the same kind of rule can apply. If they're in danger of hurting themselves or hurting others, or somebody's hurting them, you are obligated to break that confidentiality and say something. Um, you know, but if it's not to that extent, but if you feel like this person really needs therapy, then it's being honest and saying, I think you need therapy, right? And you could even say, well, I have a friend that's a therapist. They can help you find somebody if you want, or I can connect you to them, and doing it that way. And just, there's no shame in saying that I think, therapy would be a good thing for you. I could help you start the process if you want. Yeah. And then, so then you let them go, right? But at the same time, um, creating those boundaries for yourself too, so that you don't become their therapist. Make sense?
I had a question about what you've seen when it comes to maybe in our community more so. I know you're saying that the younger generation's more open to coming in and seeking help. What about our young men and our older men?
Hmm. So the younger men, I am seeing a few Muslim men. Um, usually they are in a space where they're kind of forced to, like some kind of event has happened that they had no choice but to seek therapy. Um, and but when they do come in, they realize how beneficial it is, and so then they take advantage of it. So I have noticed that with young men. Actually, forget Muslim men, just men in general, right? Or even boys in general, things of that sort. I had one client who said, "I don't want to do this." And so I said, all right, you don't have to do it weekly. Can you agree to do it every other week? He said, sure. And eventually we started doing weekly. And I saw him for 2 years, you know. Um, and I said, remember when you said you didn't mean this? But so that's kind of the younger ones. The older ones I am noticing. So I do take Medicare. So I'm seeing a lot of 65 plus. So 65 plus men, most of them, it is the wives that are saying, you need to go for therapy, right? And so they're the ones that are kind of pushing the husband out the door. But once you get them talking, they talk, you know. But it's just about gaining that trust, is a part of it. 65 plus, they're reflecting on life, especially men. I'm noticing there's the retired community is struggling. I think that's one thing that we as a Muslim community need to work on as well. I think Lamia and I had talked about it too, is we need something for these men that are retired, like some kind of social community thing, because they're completely isolated. They're getting on their wives' nerves. They've lost purpose. And then they go into this depression. But we need something for them. Mm. And I think, what you said is important too. I stress so much on choice of words, right? And so crazy is one that's, used. Lazy is one that's used so much, especially with the older generation, or even the parents saying it to the child. And every client I have said, you have to eliminate that word, right? Crazy needs to be rephrased as struggling, right? Lazy needs to be rephrased as not motivated, because otherwise it becomes this self-fulfilling prophecy, right? And you don't feel good about yourself. When you're saying struggling, when you're saying you're not motivated, there's a way to fix it, right? It's not an end-all label that you're giving somebody or yourself. So I think that's, a big part of it as well.
Anything else on Zoom? I know we're past 7. How are you on time, Sister Nadia? You're okay?
Yeah.
I know we've been asking you questions. Do you have any questions for us? Because I love seeing all the young faces, and I want to
know.
put them on the spot. So.
Well, I'm going to put everybody on the spot. So I want to start here, and everybody talk to me about how is mental health important to you, and why was it important for you to be here today?
Okay, so a lot of us actually came because we decided that this was just going to be part of our youth group
Okay.
thing. We decided to come here first.
Why is mental health important to you? Or is there anything specifically you wanted to know today regarding mental health that hasn't been addressed yet?
I mean, I think the biggest thing about coming here today was I just wanted to see what we're trying to do to address it as a community. Because I know a lot of people who struggle. I've struggled a lot. And when I was in high school, I didn't have this. And just to see.
Yeah, we can stop the recording on you. Okay. Okay, thank you. Yeah, thanks, Anya. Go ahead.
Yeah, so I just wanted to see people showing up and us showing up for each other as a community. Okay.
I did mention that I plan on becoming a teacher, so I really wanted to know what can we do to help this community, and especially those that are young, because I want to be able to, I guess, process my own issues before I start dealing with other people's issues, and not let those issues get with my issues.
Yeah.
And just understand how to deal with somebody who has mental health issues, and how to get them to where they need to be without making it worse for them or making them feel like they're not valid. I really like that word that you use, make them feel like they're validated.
Yeah.
So I feel like it's really important.
Yeah. And fun fact, sometimes the best therapists are the ones who have been through their own struggles and have sought therapy, right? And have utilized their tools. They're the ones that have the most empathy. And so they can help the most.
I think I answered it.
Say that again?
I think I answered everything.
Yeah, you did.
So for me, I felt like mental health is very important, especially for girls in a basic community, because we don't get the same amount of freedom as community. So we're typically put put inside the house. We're very